As I said last week, a lot of this information is truly scary, and I know that many of our families are feeling very anxious about this. That's completely understandable, natural reaction to something like this. But if there's one thing that I can say, it's please follow those guidelines, stay safe, stay healthy, and don't panic. Just do all you can to try to prevent the spread of this virus and flatten that curve. So critically important. The number one thing we can do is follow the guidance by the Centers for Disease Control and Prevention, where Dr. Garfien worked, as well as the California Governor's Office, and our states and localities are doing such an amazing job, and to follow the guidance from both San Diego and from Orange counties. I wanted to share some updated numbers. These are tragic, and in fact, just a few minutes ago, we got the most recent update. The United States now has the most confirmed cases of COVID-19 in the world, well over 100,000, rapidly approaching 120,000. We now have over 2,000 deaths, tragically, from coronavirus in the United States alone. And stunningly, that number has doubled in just the last couple of days. California, as of this morning, had 4,905 cases, 102 deaths. San Diego County has 417 cases confirmed, and Orange County has 321, 6 confirmed deaths in San Diego County, 3 confirmed deaths in Orange County. We expect, unfortunately, for those numbers to go up, and April to be a pretty rough month, as Dr. Garfien will explain. Right now, we're facing 2 simultaneous crises in our country. There's an obvious public health crisis, and there's also an economic crisis. And I remain of the opinion that the only way we're truly going to deal with that economic crisis is to deal with the public health crisis. In Congress, we've passed a number of measures now to try to deal with coronavirus, 3 of them. The first, back in February, the president on February 25th February 25 came to the Congress, and he asked for $2.5 billion. One and a quarter was new money, 1 and a quarter would be diverted from other sources. And back then, it really wasn't that long ago when you think about it, but on February 25th, the president felt that was an adequate federal response. And even back then, we didn't feel that was the case. And Republicans and Democrats worked together and developed a bill for $8.3 billion, which at the time we thought would be enough to help develop the vaccine and to help state and other health agencies with dealing with this issue. It became very apparent very quickly that money wouldn't be nearly enough. And so we worked across the aisle, and we got the family's first bill done. I think it was signed into law on March 18th, so really not that long ago. And that was a $104 billion bill that went to a lot of things like paid sick leave and a lot of resources that we thought, again, would be adequate. We soon realized, literally within a couple days, that too would not be adequate. And so, again, we worked as best we could between the House, the Senate, and the administration on the CARES Act. It's the largest bill in terms of dollars in American history, $2 trillion. And I thought very briefly I would go through some of the major components of it. Yesterday was a crazy situation. If you follow me on Twitter or Facebook, you know that I took a red-eye flight late Thursday night, got into Washington, D.C. I didn't think I was going to have to go to Washington, D.C. initially because we were working across the aisle and we were getting this bill done by unanimous voice vote. One of my colleagues, Thomas Massey of Kentucky, decided that we ought to have a roll call vote. The only way we were able to override that roll call vote is to get a quorum or a majority of members of Congress physically present, in order to vote or in order to override the call for the voice vote. And so many of us, we got on a call late on Thursday where we were told of this, and basically we're told if you're young and healthy and you have an available flight or another available means to get to Washington, we're going to need a majority overall of Republicans and Democrats in the chamber. They tried to use social distancing policies in the chamber, which really was interesting, where we actually many of us sat up in the gallery, 4 to 6 feet or 6 feet away as best we could from our colleagues. And then you had, scores more on the floor itself. Again, distance from one another. We had around 230 members that actually were able to make it to Washington. So a very, very bare quorum, but enough to block Representative Massey's efforts. And so we wound up passing it by voice vote. And, it was really something. The drama is behind us. The bill is now law. The president signed it into law. It's massive in scope. It's not perfect, but it's certainly better than having done nothing. It was unacceptable to me and so many of my colleagues to allow this to linger without taking bold and comprehensive action. I mentioned the two crises, the healthcare crisis and the economic crisis. The bill aims to address both. $100 billion to hospitals and healthcare providers, $16 billion to replenish the strategic national stockpile for things like personal protective equipment or PPE, ventilators, and diagnostics, which are so critically important. $1 billion for the Defense Production Act. I know that the president has since invoked it. I think that was long overdue to try to get GM and others to use their manufacturing capacity for ventilators. I've been in touch just today with GM to see how that is going. They're working with a company called Ventec to produce those ventilators. $4.3 billion to support federal, state, and local public health agencies. That's as part of $150 billion to support state and local government, which isn't nearly enough, just frankly. California will get about $15.3 billion. Unfortunately, we're going to have to dip into our $21 billion rainy day fund. If ever there were a rainy day, this is it. And that money will go, if you're a city larger than 500,000 people, you'll get the money directly. If you're smaller than 500,000, like all of our cities in my district, then you're going to have to go through the counties, through San Diego and Orange counties in order to get that money. But I'm in touch with a lot of our local elected officials about how that's going to work. Then to deal with the economic crisis, so critically important. One thing that we did is significantly invest in unemployment insurance, expand the unemployment insurance from 26 weeks to 39 weeks and add an extra $600 a week to try to better reflect what people's take-home pay actually is. And in a place like Southern California, in many cases, it's not going to be perfect, but better with that extra $600 a week. And you might have remembered that a number of Republican senators objected to that at the last minute, but they were overruled, and we got that into the final bill, and I'm happy that we did. It also expanded unemployment insurance to allow part-time, self-employed, and gig economy workers to access the benefits. And then also we included cash payments, $600 per individual, $1,200 per married couple. I think that's so critically important as well. Actually, I should say $1,200 per individual. So I think that's critically important. I wish it would have gone further because I think it should have been tied to GDP or unemployment. I think the cash payments need to continue as long as the crisis is ongoing. And the way that we did it, unfortunately, we're going to have to go back and pass more legislation downstream. And I worry of our ability to do that. But I'm happy that the cash payment was in there. There's a huge amount of money for small businesses. Basically, small businesses are going to be encouraged to retain their employees. So many of our constituents and our workers, they have their health insurance tied to their employment. And so we want to keep people employed. And one thing, obviously, we want to make sure that they have is health insurance. So I'm happy that that happened. Also, if an employee is furloughed, they're still going to be able to have health insurance during this very difficult time. It basically works with the small businesses like a forgivable loan. So long as they use 90% of the money for payroll and for related expenses, then the loan is forgiven. It turns into a grant. The legislation includes oversight and accountability measures that I fought for, that many of my colleagues fought for, so that, frankly, Mnuchin didn't just have, the Treasury Secretary didn't just have a $500 billion slush fund. I'm concerned, though, that in his press conference yesterday, that the president mentioned he may disregard some of those congressional oversight measures. I think it's critically important that we have appropriate oversight of that pool of money moving forward. And ultimately, we're going to have to take way more action on this. I think there's already a lot of discussion around a fourth bill and what that might mean and some of the things it might include. I have my thoughts on that, but we know that this is just the beginning, and we really are in uncharted waters, and we're going to have to work very hard as Congress in the months ahead to address this situation, both from a public health perspective and from an economic perspective. So with that, I want to turn it over to Dr. Garfien for his opening statement.
Thank you, Mike. So I'm sure that was a difficult decision for you to have to get on a plane at the last minute and travel, despite all the travel warnings, so that you can participate in that House vote. And so I appreciate the added burden that this is going to put on your family, because I know for the next couple of weeks you're going to be extra vigilant about watching to see if you develop any symptoms and make sure you're not exposing your family members. So
absolutely, every day. And I can tell you that my wife wasn't thrilled. I
can imagine.
Really, because I had told her I wasn't going to have to go earlier in the day. And it changed very quickly. But we can thank Tom Massey of Kentucky for that one.
Yeah, for sure. Well, I can tell you that when I told my wife I was taking a busload full of medical students down to Baja to run a clinic when we were having all the fires in Mexico and in California, she wasn't thrilled about me leaving either. But you know, sometimes you got to do what you got to do, and we made it back safe. And I hope the same for you. So I'd like to stress for everybody the point that you had made earlier about following the guidance of the CDC, the state health department, and also our local county health departments. I think that the information that they have on their websites is excellent, and it's a great place to start to get information. And the information there has been vetted, it's accurate, it's up to date, and it's probably more reliable than some other things that people might be finding looking around on the internet. And those websites will be posted on Mike's website, so you can find those easily. You know, this is an ever-changing. The news is constantly changing about the projections and the guidelines for COVID, and that can be really frustrating for the public. But I want to assure people that the world's best doctors and scientists are working around the clock to obtain, you know, all the available valid information that's out there so that they can make appropriate decisions. Although the coronavirus is brand new, there's many lessons that can be taken from well-known pathogens that we understand quite well because they've been around forever, and we understand how they work. And so we look to those to get a starting point for making recommendations. And so health officials use that to get a start and to make recommendations and set guidelines and to inform healthcare providers on how best to act in this situation. But they don't take that for granted. They don't just assume that this virus is going to behave the way all the other viruses do. So at the same time that they're following guidelines, they're also watching to see what happens. And if it's necessary to change a guideline based on new evidence that comes out and what they're seeing, they'll do that. And so, you know, when people see that guidelines and recommendations are changing, don't get frustrated by that. Trust that the information that's starting to come out is actually better and improving what we're doing, not because people are confused and are grasping at straws. So that's the good news. I also think this is a good time to reiterate the current CDC recommendations. First, continue practicing social distancing. That means not going out of your home except when it's essential. It's if you absolutely must go out, try to keep at least 6 feet away from other people, avoid close contacts, wash your hands, and avoid touching your eyes, nose, and mouth. When you're out, just sort of assume that the virus is in the community. You may be picking it up by touching other items that other people who may be sick have come in contact with, and you don't want to expose yourself to that. This is especially important for people who are at higher risk of getting very sick. This includes older adults, people who have underlying health conditions such as heart disease, diabetes, lung disease, or anybody that has any sort of immunosuppression, whether that's because of some underlying disease or because they're on medications that suppress the immune system. Some people might be infected who don't have symptoms. And so it's really, you can't say, hey, that person looks like they're well. You know, the friend of mine that came over to the house, or my, daughter who came home after, she's been with her friends, she seems fine and I don't have to worry about it. People can be infected and be asymptomatic, and they can transmit the virus. So we have to be careful to practice social distancing with everybody. If you need food, consider ways of getting it through either home delivery, having a family member picking up for you, especially older people. If you don't have to go out, really do try to avoid that if at all possible. If you do have to go out to the store to pick up food, then just be very, very cautious about how you're interacting with people. Try to keep distance from other people. I know when I go to the market, it's a little offensive if I'm walking down an aisle and I see somebody coming at me and they turn around and go the other way. I mean, if my first thought is, oh, that hurt my feelings, but I realize that they're being careful, and they're being respectful of me and as well as themselves. So I think for now, we have to get used to that. We have to understand that people are trying to be very careful. Also, if you're when you're coming back from the market, make sure that you're, washing your hands, sanitizing items. I'll talk about a little bit of that later. But you want to make sure that you're not bringing the virus into your household. And if you do, that you're cleaning all of your surfaces carefully so that you're not exposing yourself to that virus. Second, there's everyday precautions that the CDC recommends. Wash your hands often with soap and water. It works very well, especially after you've blown your nose or coughed or sneezed into your hands, or been in public places where you might have picked up the virus. Hand sanitizers containing at least 60% ethanol are highly effective, and you should use those when you can't wash your hands. And to the extent possible, avoid any kind of high-touch surfaces in public places such as doorknobs, handrails, elevator buttons, the keypad at the market. And if you do touch those things, just realize that now your hands may be contaminated with the virus, and you'll want to wash them or use hand sanitizer before you touch your mouth or face. Third, what do you do if you get sick? Well, the CDC has really good recommendations on their website. The first thing you want to do is pay attention to the most common symptoms of COVID-19, which are a fever, dry cough, shortness of breath, and body aches. If you're feeling ill, call your doctor before you go into the clinic or the hospital. Let them know how you're feeling and alert them to your condition. They may ask you to come in which case they'll be prepared for you to be coming because they know that you're on your way. Or they might tell you to stay home because you can convalesce at home. If you're not sick enough to be hospitalized, you can recover from the coronavirus at home. You don't have to be hospitalized, and it's actually better for you if you are staying at home. There's a lot of talk about masks. We'll talk a little bit about that as well. But if you are sick, wear a mask to cover your wear a mask or cover your mouth and nose. If you do cough and sneeze, use a paper tissue and throw it away when you're done, as opposed to a handkerchief that you're going to be holding on to. Also wash your hands after you've coughed or sneezed. As much as possible, try to stay in a specific room. This sort of goes to you, Mike. Stay in a specific room and away from other people.
What are you trying to say?
I'm saying that you're a hero for getting on that plane, but until you know that you're out of the woods, I think it's better to be safe than sorry, right?
Yep.
So stay away from other people in the household. Use a separate bathroom if it's available. And then disinfect frequently. Make sure that if there is any virus on any surfaces, it's being picked up. And then finally, when to seek emergency medical attention. If you develop emergency symptoms or warning signs for COVID, get medical attention immediately. This would include things like trouble breathing, persistent pain or pressure in your chest, being confused or not being able to be aroused, or bluish lips or face. That's an indication that you're not getting enough oxygen. Consult your medical provider if you have any of these symptoms or any other symptoms that are severe or concerning. And if you need emergency medical attention, call 911 and notify the operator if you think you've been exposed or that you have COVID. And with that, I'll turn it back to you, Mike.
Thank you, Dr. Garfien, as always. Appreciate that very much. We have a ton of questions. We'll try to get through as many of them as we can. And again, if you have questions, go ahead and email us townhallquestions@mikelevin.org. We're also streaming this both on Facebook Live and on Twitter and on our website. For those watching on Facebook or Twitter, if you post comments and things like that, we will look at those as quickly as we can. We're going to try to get through as many of these questions that were submitted in advance of the town hall to start. Dottie in Dana Point asks, I would love to hear more about how this stimulus program will be paid for. Oh, great question, Dottie. I am also concerned. There's good news and there's bad news. It's going to be paid for by borrowing money, and we're going to be ramping up our deficit this year. As it was, I believe our deficit to GDP ratio was already too high. That will easily double or go even higher. The estimates that I've seen say that our deficit to GDP ratio this year will be on the order of magnitude of 11-12%, which will be even higher than it was in World War II. And look, long term, we can't continue to do that, but this is an emergency and we have to do this in the near term. The good news is that interest rates are very low, so the cost of borrowing this money is much lower than it would be, if interest rates were higher. But I think the biggest challenge that I see is that, we have racked up $3 trillion of debt in this administration. When the president was running for office, he said he would eliminate the national debt within 8 years. And unfortunately, the exact opposite of that has happened. We've increased the national debt. In times of economic prosperity, I think we should have been more cognizant less slack to deal with the current crisis. Interest rates were already very low. The Fed had already cut things very low, and our deficit already was over $1 trillion for this year. So there's good and there's bad. It will be something that is paid back over many, many years, though. But the stimulative effect is absolutely necessary because the economic calamity that would result if we didn't intervene in this way, I think, would be even worse. And we're going to need to do more. I think we're going to need more direct cash payments. We're going to need to deal with mortgages. If you think about it, a lot of people aren't able to pay rent, whether it be on residential or commercial or business mortgages. As a result, a lot of those mortgages are going to be in default. A lot of the property owners that hold those mortgages are going to be in default. So this is a huge issue as well. But it's going to be paid by borrowing money is the short answer. Here's a question for Dr. Garfien from Shannon Branch. Shannon asks, I believe it would help many to understand the importance of masks for the wearer and the non-wearer. Does the science show protection for all types of masks? The types from Home Depot along with homemade ones? Is this a simple, cheap way to flatten the curve and save lives?
Well, Shannon, that's a great question. And everybody, I think, wants to know the answer to that because it feels like it's the right thing to do. So a little bit of information about masks. There's basically two reasons to wear a mask. One is a person who is sick can wear a mask to prevent the virus from being expelled when they cough or sneeze. It's expelled on droplets. Those droplets circulate in the air. Sometimes those droplets dry out a little bit, and the smaller ones can circulate in the air for longer periods of time, which can then be breathed in by somebody else and cause that other person to be infected. The other reason to wear a mask is to keep the uninfected person from breathing in any of those particles. And then we think about healthcare workers and people on the front line who are exposed to people that are known to have the virus. And so the type of mask is really related to what you're trying to do with it. So if you're trying to prevent a cough from being expelled out into the air, your typical dust mask or even a homemade mask is going to be sufficient. Also, when you go to say a dentist or a doctor and they put on a surgical mask, these are masks that are intended to really prevent anything that they're breathing out from exposing the patient. However, the pores in those masks are not as small as the masks in the mask that a healthcare provider should be wearing to prevent them from inhaling the virus that might be in the air. And those we typically, the most common ones that people think of are the N95 mask. The pores in them are very, very small and should block out most virus that might be circulating in the air. So unfortunately, there's not enough of these masks to go around. the masks themselves can become infected or contaminated with virus by people coughing or breathing in them, or if a doctor's wearing a mask for long periods of time, the virus is hitting the mask, it's just not going through it. So the virus is on the outside of the mask, which is why they need to change them frequently to make sure that they're not contaminating their hands if they touch the mask and then touching a patient or something like that. So because they're seeing multiple patients throughout the day, they're changing their masks throughout the day, a doctor might go through 10 or 15 masks easily in a day. And it's not just doctors, it's the nurses, it's the other ancillary staff that are helping to take care of patients. So the demand for these masks is very, very high. So if you hear about shortages, it's because we want to make sure that the people on the front line that really need the protection have the masks that they need. And so we're trying to be very careful about using them. And I know that there are efforts to increase the production of masks, and the president has worked to get more masks put into the supply, and they're getting sent out to healthcare facilities across the country. But we still have to be cautious of how many are being used, because there are still more patients that are people becoming infected, and the burden on the healthcare system is increasing. And so we need to be careful with those.
Thank you for that, Dr. Garfien. Letitia in Oceanside asks, I'm a healthcare worker at a local hospital. My kids are older and can stay home and care for themselves, but this is not the case for a lot of my coworkers. They're having to make the tough decision, either stay home with their kids or go to work and care for patients. What can you do to make sure my coworkers receive free childcare so they can go to work and take care of our sick patients? Letitia, that's an excellent question, and many of us, myself included, fought for in the third bill, the CARES Act, free childcare for the parents of, or for the children of emergency personnel and healthcare personnel. That ultimately did not make it into the final package. It was one of the many things that I wish we would have done, and I think we're going to go back and try again with the fourth stimulus. To the extent there's good news in that stimulus package, it is that many of the childcare providers themselves can qualify as small businesses for all those small business incentives to try to stay open, to try to be able to keep people on payroll. And what I would also say that's positive is a number of states and localities are taking it upon themselves to provide that free childcare. I know the state of Colorado is now doing that, and I'm sure California is looking at it as well. I think it's so critically important because you're absolutely right. We need our medical professionals to remain on the front lines, and childcare is tough for everyone, but particularly tough for those who have to sacrifice their own health and safety for the health and safety of others on the front lines of this pandemic. So your point is very well taken. From Paul in San Clemente, we're forced to close our business. Sorry to hear that, Paul. But our landlord is still forcing us to pay the full amount. Besides going in debt for loans, what should we do? I asked for prorated, but they scoffed at it. First thing I would say is that Governor Newsom just issued an executive order that authorizes local governments to halt evictions for those that are affected by the coronavirus. So, our office could certainly help you look at that. The federal package that we passed prohibits borrowers of federally backed mortgage loans and federally subsidized properties from evicting tenants or charging late fees due to non-payment. However, I don't think that would apply to your case. I'm very sorry that you had to take this step and close down. I would encourage you, please reach out to our website or to our official side, to our office in Dana Point, and we'd be happy to talk to you about what programs may be available for the rent issue, as well as for your workforce or your former workforce, and for you personally. Dr. Garfien, Derek in Oceanside asks, how much does carry-out food increase risk of contracting COVID-19? And I'm actually interested in this myself.
I think a lot of people are. That's a good question. Although there's been a few studies that have been done, one that was recently published in the New England Journal of Medicine that shows that The virus can survive on surfaces like cardboard for several hours, potentially up to a day, and on other surfaces like plastic and stainless steel for even longer. We have to consider that there's a possibility that things that other people touch or sneeze on can become contaminated with the virus. So we want to think about what's practiced in medicine is what we call universal precautions, which is just the assumption that everything is potentially infectious, and we want to make sure that we do everything we can to avoid putting any pathogens that we might come in contact into our bodies. And so one thing I can assure people of is that the virus is susceptible to heat. So cooked food, is unlikely to have active virus in it. So if you do pick up some carry out and, maybe it's not really hot by the time you get it home, it's okay to stick it back in the microwave or heat it up a little bit, and that will certainly kill any virus. More than the food itself, which I don't think is very likely to be contaminated, would be the containers that they're in. So one thing you can do is when you get the food home, immediately take the food out of the container and put it on to a clean plate or another dish. Heat it up again if you'd like, and then carefully discard those containers. You can just put them right in the trash, but just make sure that they're, not in your environment where somebody else might touch them. And when you're finished, wash your hands. Consider the possibility that your hands may have gotten contaminated in touching those containers, and so wash your hands afterwards. Also, if you've had the food or the plastic bags and things on your countertop, consider spraying them down with a disinfectant like 10% chlorine bleach solution or a sanitizing disinfectant solution. And then the last thing I would say is when you are actually engaging with the person who's either delivering your food or you're picking it up from, is remember, this is another person. We don't know who's infected. They don't know if you're infected. You don't know if they're infected. So be respectful of maintaining distance. Wash your hands after you've touched a credit card or any sort of transaction or cash, and minimize the amount of contact. Get out. Don't stand there talking about how rough it is to be stuck at home with the person who's commiserating with you behind the counter. Let them get on with their job, and you get on to getting home and eating.
And these are almost exactly the same rules we would follow with any delivery, right? So, from an Amazon or what have you, in terms of the boxes or the bags that come in. As I mentioned last week, my kids who are 7 and 6 like to use whatever boxes that come in as toys, and we've had to discourage that in the wake of all of this. But same rules. Adele in Solana Beach asks, the Environmental Protection Agency issued a sweeping suspension of its enforcement of environmental laws Thursday. I noticed that, Adele, probably not surprised. Telling companies they would not need to meet environmental standards during the coronavirus outbreak. How can this be? How can they simply suspend laws? What protects us from the suspension of all laws? Well, Adele, you were spot on, and those are the right questions to ask, and we are going to be asking exactly those questions and others of the Environmental Protection Agency in an upcoming letter from many of us concerned by that article and by what we're reading. And make no mistake, we've got decades of bipartisan work that has gone into our current federal framework of environmental protection. The Environmental Protection Agency was created during President Nixon, his administration, in broad bipartisan consensus around the creation of the Clean Air Act and Clean Water Act in Congress. And on down the road, for decades, we've had strong bipartisan support for clean air and clean water. And I hope we still do. I hope that's still the case. What I can tell you is that I think there are a handful of polluters out there who candidly see this as an opportunity to bend the rules or to change the rules. And we can't allow public health and safety to be put at risk. The reason why we're so concerned about COVID at the end of the day, in addition to the economic impact, but most important is the public health impact. Just the same, the reason why we have an Environmental Protection Agency at the end of the day is the public health and safety of all Americans. And so we cannot use one public health crisis as an excuse to create another. And that's what we'll be demanding the information of the EPA and others involved when I get this letter. I was about to say when I go back to Washington, but I promised Dr. Garfield I'm not going back to Washington this week. Great question, though. Thank you. Julie from Facebook asks, will there be a test later to let us know if we had the virus and have recovered? If so, will that suggest we are immune? Great question, Julie.
Right. I really enjoy that question as well, Julie. And as an epidemiologist, I'm excited about the possibility of this test coming out. What I'm aware of is that the CDC is working to develop a new laboratory test that will assist us in understanding who's been infected and who hasn't. So the current test for the SARS-CoV-2 virus, that's the virus that causes COVID-19, is a test that looks for the virus itself. So when they do a swab of the nose or the throat, they're looking to see if there's actually virus in those compartments. If there is, then that's an indication that the person is actively infected, that person is infectious, and that person should be managed in a way that minimizes or prevents exposure to others. However, when the body responds to viral infection, it responds by producing antibodies, and that's what protects us from becoming infected again. It also helps us to fight off the initial infection. This is the purpose of vaccines. Vaccines are designed to stimulate our bodies to produce antibodies that will fight specific infections. So there's some good evidence from other coronaviruses that when you do have antibodies, it is an indication that you're protected and you won't become infected again. And it also means that you won't be transmitting the virus to other people once the viral test comes up negative. The nice thing about these tests is that they're very, very useful in helping us to tease out who's susceptible, who could become infected, who's actively infected, and who has previously been infected and is now immune. We don't know how long the immunity will last. We know for the short term there is a protection, and so those people can go back to work and go back to resuming their lives and presumably, go on to helping to take care of people that might currently be sick without risking being sick. What we don't know is whether or not that immunity will last a few months or a few years or a lifetime. We'll only know that with more time after this pandemic ends.
Thank you for that. Anne asks, how do homeless folks get shelter if they don't have a home? Well, I would say there's a few things here. One is that San Diego and Orange counties both have set up temporary facilities. I know San Diego has set up Golden Hall and the Convention Center as temporary facilities to house people, to get them off the street. I also know that for those that are symptomatic, there are a bunch of motels that are being discussed and hotels that they're trying to set up for people that are symptomatic. Just same in Orange County, I know there are facilities in Fullerton and in Santa Ana that have been set up on a temporary basis, and then there are hotels as well for those that are symptomatic. What I would also say is, on our website, we have the links to San Diego County and Orange County. More information will be posted there with regard to this. The county websites will post more information with regard to these challenges. The other thing that I'm looking at, in addition to the homeless population, is preventing additional homelessness, and that's where the mortgage and rental assistance is so critically important. I would have loved to see a nationwide moratorium on all eviction and foreclosure. What we were able to do in the CARES Act is we were able to say for any of the federal programs, FHA and Fannie, Freddie, VA, and the others that will not evict people prematurely or during this crisis at all. There are also a number of states like California, and I think Gavin Newsom was right to do this, to delay any eviction for the next couple of months. Of course, if people aren't paying rent, and that's just a natural thing that will happen with the economic situation being what it is, then we're going to have to take measures downstream on mortgages as well. So I'm very cognizant of that. But it's absolutely critical that we try to limit community spread among the homeless population. I know both Orange and San Diego counties are working very hard in that regard. Question from Paul in Oceanside for Dr. Garfien. He asks, I'm sure I'm not the only one that still needs to go to the grocery store or drugstore. Despite the pandemic, the dogs and I still have to eat. But I'm wondering about how to behave when going out to shop. What is the best approach to these duties that limits the potential exposure to COVID-19? Many thanks.
So, Paul, that is an important question that a lot of us have. I think, number one, don't go if you're sick. If you're having symptoms, see if you could find somebody else that can go for you, a family member, a neighbor. Try using one of the online services to have food delivered to you. If it's essential that you do go out and, and then what we want to do is maintain social distance while we're shopping. So, if it's try to go at a time of the day when it's not, usually the middle of the day is better than, early in the morning. Try to get in and get out as quickly as you can. Also be aware that, the merchandise that's on the shelf has potentially been touched by other people. So, when you go into the store, sure, you can wipe off the handle on the shopping cart, and that's not a bad idea since other people are touching it. But just sort of assume that the whole time that you're in the store, you're potentially picking up virus on your hands. So be very careful not to touch your face while you're in the store. When you're all finished, get the groceries, put them in and get them home. Maybe before you get into your car, if you have hand sanitizer, clean your hands before you get in your car so you're not touching your steering wheel. And then again, when you get home, unload your groceries, discard as much of the external containers as you can, clean your hands again afterwards, wipe down the surfaces in your home. I think that shopping is an essential. I don't think that it's necessary for you to stay home, but you want to try to minimize that exposure as much as possible and make sure that if you are touching surfaces that you're cleaning your hands and cleaning anything else that might have been touched.
That all sounds great. The one thing I would add is that a lot of the stores are doing special hours at the beginning of the day, opening early for more vulnerable populations, whether it be seniors or folks with disabilities. I know most of the stores have put that in place, and I'm sure we could add a website or add a list to our website. But I would also check with those individual stores that you frequent to see if they have special hours for those more vulnerable populations.
Right.
A follow-up to that question from Mary. She asks, once handled by an infected person, how long will the COVID virus remain a threat on plastic covers, bags, and surfaces? For example, grocery store plastic bags, newspaper covers, supplies received by mail in cardboard boxes.
Right. Well, in laboratory testing situations, it's been shown that if you spray virus onto a cardboard or plastic surface, it will survive for a fair amount of time. Cardboard, maybe about up to a day. Plastic, maybe up to a couple of days. The thing about this is that it's not an off-or-on situation. The amount of virus that is still viable and able to infect somebody goes down over time. And so the amount of virus that's still alive on those surfaces diminishes over time. So, so if the box has been sitting in a warehouse for, a day, by the time it gets to you, maybe the amount of virus that's on it is lessened. But I think you want to be careful to, minimize the amount of contact that you have with those surfaces, especially if you think that there's a high probability that somebody who is infected touched them. And so, as we sort of talked about before, discard the outside containers. So I know a lot of us will take our own grocery bags into the market. And right now it's probably okay to, take home the paper bags or the plastic bags that they're bringing you instead of keeping this cloth bag that you take back and forth. That way, at least when when you get them home, you can discard those. The other thing is if you put those materials, out in the garage and you leave them there for a few days, it's probably any virus that was on them is going to die. And so you can reuse them at that point. But we don't know exactly how long that would be. So, best to err on the side of caution.
Thank you for that. A few different people asked, what can we do when we see groups of people who are not complying with social distancing orders? I presume they mean better than yelling at them or something like that. Well, throughout our district, each of the cities have put different orders in place. Most of the beaches, the reason we all live here in such a beautiful place is to go to the beach. And right now we're not able to go to the beach in virtually the entire district. And I think that's a good thing, frankly. I think that, I was on a run down in Dana Point Harbor fairly recently, and I saw people out there surfing as though nothing was going on. And so I do think that was appropriate because it turns out people don't voluntarily adhere necessarily to social distancing measures. So they have shut down a lot of the different parking lots for parks and beaches and things of that nature to try to discourage or try to encourage the adherence to social distancing. I would say if you see something that really violates the compliance with that you should call your city or you should call your local police department. The non-emergency number, of course. But that's what I would do just as a concerned citizen. And, if nothing else, they can refer you to the appropriate people that can at least look into that and handle that. But this really is an unprecedented thing. I saw the cover of the UT the other day had a guy that was busted by police for surfing, something I never thought in my life I would see, having grown up here. And I hope we get back out there very, very soon. But for right now, please follow those guidelines. Klaus in Del Mar asks, the company that I founded has 46 employees, most of them in San Diego. Our business is down by 90%. I'm sorry to hear that. With our current resources, we can survive a few weeks. We feel we have a great obligation to our employees who built this company, and we need to preserve their talent so that we can restart strongly once the crisis is over. We would urgently need an unconditional zero-interest loan to allow us to do so. Is Congress considering measures that could get such a loan in our hands very quickly? Yes, we are, and we have, and we did. There is a website, disasterloan.sba.gov/ELA, where you can apply for an emergency loan with the Small Business Administration for exactly this type of thing. You can also contact our office in Oceanside or in Dana Point, and you can ask about the specific programs that are being put in place as part of the CARES Act. There's $350 billion in that bill out of the $2 trillion, specifically for small business assistance. And the way it's supposed to work is so long as you're using that money for payroll and your normal business operations to keep people on the payroll and to keep the lights on and the doors open to the extent that you can keep the doors open, then the loans are fully forgivable. They turn into, in effect, cash grants for those keeping their businesses open. So please contact our offices if you have any questions about how you access those programs. From Mary and Barry in Oceanside, they say, thanks for holding these virtual town hall meetings. My husband and I are wondering if the availability of coronavirus testing in the U.S. is being artificially suppressed in order to keep the numbers down, since, as we know, this is them saying that, not me, Trump, quote, likes the numbers where they are and was willing to strand passengers on a cruise ship rather than have their positive test numbers counted. Well, the bottom line is I think we're well past that period. I think everybody now acknowledges with the U.S. having the most cases in the world that we need testing, testing, and testing. That is the way that we're going to be able to flatten the curve and prevent the huge harm to our economy. Just so everybody understands, we back in January and February saw what was happening in China, saw what other countries were doing. South Korea and the United States had on the very same day, the first case domestically. South Korea went all in to try to develop as quickly as they could a standardized, effective testing protocol. They beat us to testing hundreds of thousands of people when we hadn't. That time was very valuable time. We're now trying to play catch up. We've now tested more people total than they have, but in terms of testing per 100,000, we're still well behind where those other countries are. And that's the critically important number. What they're doing in some other countries, and I mentioned this last week, like in Israel, for example, it's a smaller country, 8 million people. They're already testing groups of people who are asymptomatic to try to effectively limit where the virus is. And if they can do that, then they can be far more effective in their figuring out where within their population the virus is. That'll help them far more rapidly be able to open certain parts of Israel and in the United States. All the models that I've seen, we've got an expert. I'm going to turn to the expert on this because you helped build some models, many models, and I'd like to get your perspective on this, on the testing.
Well, I couldn't agree with you more, Mike, that we do need more testing. More companies have come online to develop tests. State and local health departments now have the ability to provide testing. Even with that, though, it's taking time in order to have enough reagents to conduct the tests and get the tests out to people that need them. And another thing that's slowing down testing is that the specimen collection devices, the swab and the container that they're put into to get the sample to the laboratory is also in short supply. And so companies are stepping up to try to increase the supply of the sample collection kits. I did just hear today that there's actually a rapid test now that's available that can be performed in 15 minutes, which is really crucial for urgent care settings where a doctor might need to triage a patient and make a quick decision to figure out if the patient has, symptoms from the flu or symptoms from coronavirus. We've always had a test for the flu, and so when somebody is seen in a clinic who has symptoms, it's very easy to do a flu test to rule flu out. But if the flu test is negative, that doesn't say for sure whether or not it's coronavirus. And so we need those coronavirus tests as well. I think they're coming. I think that the testing is increasing. As far as suppressing numbers, I think that there's a lot of scientists like myself out there that are clamoring for the data. If there were test results that were available, we'd all want to get our hands on them as quickly as possible to be able to, model the projections of the infection. I don't think that there are tests that are being that are not being used for any nefarious reason. I think that there's actually a legitimate shortage of tests, and so doctors and healthcare settings are doing the best they can to make sure that they have tests available for those that are in greatest need. And that's changing. So I think that people may have heard, so-and-so went to see a doctor and they thought they had coronavirus, but they didn't get tested. As more tests become available, we'll hear less of those stories, and the criteria for who gets tested will change over time as the pandemic evolves and as more tests become available. But I think that we need to be confident that our healthcare system is doing the best they can with the resources that are available.
Thank you for that. Tom in Oceanside asks, says, the other night we heard on the CBS News the U.S. government has 35 million surgical masks and 12 million respirators in stockpile. The government released 1 million to our 3 million health workers who are running short. What do you know about this? It makes no sense to me. Well, a couple things. One is the Strategic National Stockpile, I think we now know, didn't have enough supplies. We weren't ready for anything on this scale. And I think they're playing catch up right now to do the best they can with the supplies that they have. They are never going to fully eliminate supplies from the Strategic National Stockpile because you never know when you're going to have a terrorist attack or a natural disaster. But nonetheless, I think they need to do a lot better. Frankly, I haven't been very impressed with the head of FEMA and some of his more recent discussions on this, and I think they need to ramp it up. We also sent billions of dollars for administration and for FEMA and the appropriate entities to buy more supplies for the stockpile. We've sent them billions of dollars with the second bill and the third bill that I mentioned. The CARES Act sends them $1 billion and billions, and then it also has the Defense Production Act in there where the government can directly use the Defense Production Act. We give them another $1 billion to go buy stuff under the Defense Production Act. And I'm encouraged to finally, after many days of delay, see the president invoke it for ventilators. And no more messing around saying we don't need the ventilators. I don't think anybody thinks that Governor Cuomo meant that we need them today. Just because he can read a curve, a prediction, that he's going to need them. This isn't rocket science. We have to do what the projections and the models say that we must, or our healthcare system will be overrun, and we'll have to make decisions, life and death decisions, that nobody wants to see made in this country. And anything to add to that, Doctor?
No, I think you got the answer right on that one.
Okay, here's another question for both of us from Daniel in Carlsbad. Is there anything we can do in our communities to help? Please advise. Building temporary hospitals, organizing bed donations for hospital beds. Many young people will accept the call to duty. Well, thank you for that, Daniel. The distancing and the other guidelines that Dr. Garfi mentioned. But there are a lot of ways you can give back. On our website, we'll make sure for the San Diego Food Bank, Feeding San Diego, those other organizations, if you can donate financially. There are plenty of volunteer opportunities in Orange County through 10c.org, which is a great website. And then California has serve.ca.gov to have all the volunteer opportunities in throughout the state of California. But thank you. And I'm so encouraged when I hear people in our community and hear what they're doing right now, whether it be even sending food to our frontline healthcare workers. I was just on a call earlier today where people are sending food to the emergency workers at UCSD. So everything helps. Dr. Garfield, anything to add?
I agree with you on that. I think that there are places that need extra assistance. They're having trouble finding volunteers because people are being told to stay at home, frankly, and they're not sure if it's safe to go and volunteer at these organizations. But I think that the organizations have prepared for these activities. They're making sure that people are practicing safe practices to ensure that their volunteers aren't being infected, and I think it's a worthwhile cause. I think the other thing that people can do, and I agree with you, Mike. I really appreciate knowing that our community, our neighbors are all trying to do what they can to help, but it's a confusing time. It's hard to know what to do. Healthcare workers are going to work every day, and they're coming home, and there's always that risk that they might be exposing their families. And so anything that you could do to support a healthcare worker, a doctor, a nurse, a staff member who has an essential position where they have to go to work, or an emergency medical personnel, firefighters, they're always at risk of bringing something home to their family, and there's a risk to their family. And so if there's something that you could do to make their life a little easier, I've even heard about some families where the kids have gone to live with a family member or a relative so that they're not there where the healthcare worker is coming home every day. It's not what we'd like to do. I know how much your kids mean to you, Mike. It'd break your heart if you couldn't be with them. And I know people feel that way too, but I think that other people have realized that, they'd rather have them safe than to risk. And then the other thing I would just say is that people need to eat. A group of my friends and I have been preparing meals on weekends for a men's shelter in Carlsbad for the last few years. They have cooks there throughout the week, but they don't have anybody to cook on the weekends. And so if volunteers come in and bring the food and cook, it gives a meal to those men, so they don't have to go other places to get it. And so we debated whether or not we should do it now, but we feel like the time is still important, so we're doing this tomorrow night. But we've scaled down our crew of cooks, so it's going to be a skeleton crew, so we're not on top of each other, and we'll take all the necessary precautions to minimize any risk to us or to the residents that we're going to be serving. So I encourage
that is awesome.
Do what they can.
Very cool. Very cool. Thank you so much for that. Question for you, Doctor, from Parissa. She asks, is our region setting up separate medical tenting and bedding like Washington State is doing? Is this something we can have our region start doing in preparation? It's a great question.
Yeah, it is a good question. So 19 out of the 25 hospitals in Orange County with emergency departments have set up surge tents. I know UCSD is doing the same, trying to handle the capacity in the best way they can. Governor Newsom has signed Senate Bill 89 and Senate Bill 117, budget bills that provide $500 million in general fund monies to help California fight COVID-19 and authorizes an increase of up to $1 billion. Part of this funding will increase hospital bed capacity and purchase medical equipment to combat the coming surge in COVID patients. Also, the federal government is providing 8 mobile field hospitals, also known as federal medical stations, to California. The Cal OES is deciding whether where these should be deployed and when, and you know, they've been encouraged to and health officials have been health officials have been encouraged to request these resources and make them available if offered.
What I can tell you about that is, you know, we've got a couple things. One is we've got the hospital in San Clemente, which shut down a number of years ago and is sitting there vacant. You know, I know there's that project has been very controversial for some time. I'm sure there'll be strong feelings on both sides about it, but I know there's discussion going on between the state and the people that operate or did operate that facility. Because, you know, it's sitting there vacant and it may be a good site, it may not, I don't know. They have to look at the physical plant there. Just the same, we've had property owners that have come to us with commercial buildings and they've said, we're happy to use our 25,000 square foot building, vacant building for temporary hospitals. So we've routed all that to Cal OES and they're having those discussions. If anybody watching, if they have facilities that they think might be useful for that purpose that are vacant, you know, obviously let us know because it's going to take an all hands on deck approach to make sure we have the beds necessary. Dr. Garfien Russell in San Clemente asks, what is the recommended regimen for treating yourself at home if you suspect that you have become ill with the COVID-19 virus? I assume Tylenol for fever. What other therapeutics should we have available at home to take?
Right, that's a great question. So the coronavirus is a virus, and viral infections can't be treated with antibiotics like bacterial infections can. So we really have to rely on our bodies to fight off the virus by producing antibodies and ultimately fighting the infection. There are some medications, and we'll talk a little bit about that more later, I believe, that are being tested as antiviral medications. But for now, the best treatment is really just taking care of yourself at home. And so with the fever, there are some medications that can be used to reduce fever, like Tylenol. There's been some concern about using ibuprofen or Advil because of some data that came out of the China experience where there might be some concern that these kinds of medications might be harmful. But at this time, the FDA is not aware of any scientific evidence connecting the use of what's called non-steroidal anti-inflammatory drugs like ibuprofen, that they might worsen the COVID-19 symptoms. The agency is investigating this issue further and will communicate that information if anything comes out. But at this time, there's no advice against using ibuprofen. Tylenol is certainly safe as a fever reducer. The main thing is get your rest. Really take it easy. Don't try to push it. Rest as much as you can. To treat the symptoms, you can take a hot shower or a bath to ease the sore throat and cough. Drink plenty of liquids. And I know that some people will take medications that might have some alcohol in them, or they might, rely on some old family recipes of, a little whiskey with some lemon and honey or something that might be soothing. And, I wouldn't tell people that that's not a good idea, but I think we want to take those kinds of treatments in a very limited quantity, I think, because, alcohol is not good for your immune system. And so you don't want to do anything that's going to decrease your ability to fight off the virus.
So that's not what they mean when they say 60% alcohol kills the virus?
Yeah, you want that on your skin, not on inside your body.
Got it.
Right.
Okay, good to know. Charlene asks, I'm most concerned about the GOP adjustments to the stimulus package. Please make sure that fossil fuels, attacks on our environment and wildlife are not being implemented. Thank you for all you do. Well, I agree with that, Charlene. And it's very interesting what happened. The GOP proposal, as we initially saw it, included a $3 billion bailout for the oil industry, and also said that they wanted to top off the Strategic Petroleum Reserve. And so me and some others, we wrote a letter saying, no, that's not a good idea. If you're going to give a handout to the oil industry, you also need to make sure that you acknowledge the damage being done to the clean energy industry, specifically the massive number of solar installations that will not move forward, and wind installations and all the rest. And for doing that, just for saying that we want a level playing field, some of our opponents suggested, without any factual evidence, that we're trying to politicize the stimulus and the recovery. Wrong, and wrong. And the facts don't weigh that out. All they said was that if you're going to give it to the oil business, don't forget about clean energy. Now, what wound up happening is neither the oil companies nor clean energy got much of anything in this recovery, anything specific to energy. So we're going to have to continue down the road with the fourth bill. I'm sure this will be discussed again. And I'm, as we said before, I'm concerned with the EPA flouting the environmental safeguards that are in place from a public health standpoint. Thank you for the question. John at UCSD asks the following, I think it's for you, Doctor. What is the correlation between smoking and COVID-19 mortality rate? I read that among older adults in China, men, most of whom smoke, died at a far higher rate than women, most of whom do not smoke. Seems intuitively obvious, but I'm curious about the strength of the correlation.
Well, I wonder if John is one of our public health students, because he asked a very intelligent question.
Hopefully not a smoker.
Hopefully not, or a vapor.
That's right.
So this is an interesting question. It's been observed not only in China, but in other countries where the pandemic is taking place now, where men seem to have a higher mortality than women by about 2 to 1. And so with that information, people have speculated about the reasons. Is it a biological reason, or is there something else that might be explaining it? And certainly smoking being more common among men than women is a reasonable explanation. Anytime you do damage to the lungs, it decreases the capacity, and so there's less healthy lung tissue left. And so when you get a viral infection like COVID that attacks the lung tissue, it's certainly going to affect those people more. There's also could be other risk factors, such as men are more likely to have hypertension. Men may have other underlying health conditions. Men may work in occupations where they're exposed to chemicals or particulate matter, like working in construction, or other jobs where they might have more underlying lung injury, and that could be part of it as well. The data's not out on that yet. I think what we need to do, it's certainly easy to calculate a relative risk for smoking by itself, but until we actually have the data to look at the potential confounding factors such as other underlying diseases, genetic factors, age, race, ethnicity, things like that, figuring out what the actual independent effect of smoking is on the risk of mortality from COVID, we won't know that for a little while.
And smoking is bad enough on its own.
Exactly.
Much less worried about coronavirus because of it. Next question from Jill in Carlsbad. Please comment on abortion rights being held hostage to passage of one of the stimulus bills. Well, this was unfortunate that this was politicized, where the bill applies the Hyde Amendment. The Hyde Amendment's been around for many decades. It says you can't use federal funds for abortion. And that was in this in the whole bill, and it was particularly at issue with regard to the $150 billion that went to states and localities. The way I see it, it's just very unfortunate that this became a political issue because at the end of the day, this bill was so critically important to move forward. The last thing that we needed to do was be, ginning up partisan political attacks. So. The Hyde Amendment is in the bill. Dr. Garfien, Bruce in San Clemente asks, please explain what would trigger extending the shelter in place beyond April 19th. Could it be extended for over 1 month? And some places are extending it longer and other places are not. You want to comment on that?
Yeah, this is where those models are really very important. By watching to see how many infections there are every day, how many deaths there are, how many people are recovering over time, we're able to try to project out into the future what we think might be coming down the road. We do this in all fields, not just in healthcare. They're being used in economics. They're being used in other fields to understand what might be coming, so we can anticipate and make appropriate preparations and decisions now. Unfortunately, we're still at the upswing where this epidemic is still taking off exponentially. We're seeing an increase in the number of cases every day. We're not seeing the decline that they've seen in China after their very, very harsh measures to try to limit the spread of the disease. So I think it's too early to say how much longer this is going to last. I think if we do see the numbers start to come down, we're starting to get a handle on it. I think that'll be a very good sign that what we're doing is working, but that's not a sign that it's time to stop. And what that means is that what we're doing is helping and we need to continue that. But what the concern is that if we stop our approach to preventing transmission by going back to work in large masses and by going back to school and by not sheltering in place, then the people that are still sick are going to be interacting with people that are susceptible, and we're going to see another wave of infection. And I haven't seen any evidence of that happening in China yet, but there's definitely a possibility. I'm not sure exactly how stringent their restrictions are currently and how that's affecting the epidemic in China. But it certainly makes sense from an epidemiologic perspective that if we stop too soon, the people with the infection are going to be coming in contact again with people that are susceptible, and we're going to see an increase in the amount of infection again. So I think there's a few things that can help us to speed things back to normal. One of them is more RNA testing, the test for the virus itself. That if we can get more people tested to find out who's actually infected, especially those people that might have very mild symptoms or no symptoms at all, we want to know if they're infected, so we can keep them away from people that are susceptible. Also, by introducing that antibody test, the test that'll tell us who's already been infected and who's actually immune, will help us to know which people would be safe to go back to work and who is not susceptible to becoming infected again. The other thing is discovery of effective treatments. When we have treatment that can decrease the amount of illness by doing a few things. One is by decreasing the duration that people are actually have the virus and shedding the virus. That'll prevent more transmissions. But also if we can keep people off ventilators or keep them out of the ICUs and keep down the number of people that have to get hospitalized, that'll decrease that burden on the healthcare system. You know, if this was a common cold or a flu and everybody can just sort of get it and get over it without dying, this would not be as big of a problem. But the fact that the mortality rate is so high with this disease and the burden on the healthcare system is so high, we can't afford to have a lot of people getting sick all at once. And then the last thing would be the development of a vaccine. Now, there is a vaccine that's in phase 1 trials right now. That'll take, I believe, about 6 weeks or so to get the results of that. But that trial is just showing whether or not the vaccine is safe and has some potential effectiveness. Then after that, we still need phase 2 and phase 3 trials to really see if the vaccine works. So we're really looking at least a year off before we have a vaccine that we can give to the general public. Now, it's worth pursuing that because with the vaccine, we'll also be able to get people back to work sooner because, you know, instead of worrying about that second wave, we can vaccinate the susceptibles and then let people get back to their routine lives without having to worry about that group becoming infected. So I think we need to keep on with what we're doing and working, working with the scientific community to advance these developments that are going to help us to get back to work sooner.
Excellent, excellent. And I'm really proud to represent an area where we're doing a lot of that work and kind of on the bleeding edge of a lot of the diagnostics and the therapeutics and the vaccines. So, onward, and I want everybody to be successful. So critically important that we kept the NIH and NSF budgets robust.
Absolutely.
Those were under attack, for the last few years as well.
Don't forget the CDC.
And the CDC. Oh, absolutely. Absolutely. Donna in Oceanside asks, like many retirees, my IRA has been decimated due to the coronavirus stock market plunge, yet I'm still required to take a minimum distribution, which reduces my IRA even more. Would Congress consider allowing retirees over 70 and a half an option to reduce their required minimum distribution to perhaps 50% for this year, so people have a chance to rebuild their accounts? This would be a way the government can help retirees without spending a dime. Donna, that is a really good idea. And if my team, hopefully my team is watching this right now, if we could follow up on that tomorrow or on Monday and discuss whether that might be something we want to propose for round 4. Really good idea. One thing that we included that I and others advocated for in the round 3 in phase 3, the CARES Act, is you will be able now to withdraw without penalty up to $100,000 from your 401k. And obviously we want people to keep their money in their retirement accounts, but if you need immediate access to that money, then you're able to do so without the 10% penalty. So if it's in a conventional 401k, you still have to pay taxes on it. But you won't have to pay that, and that's if you're under the retirement age. So if you're in your 40s, 50s, 60s, and you've saved up a nest egg, you'll be able to use up to $100,000 without the penalty. Next question from Amanda in San Juan Capistrano. And this is for you, Dr. Garfien. Please offer some clarification on the current statewide mandate. Is socializing outside of one's household completely off limits, even with social distancing and a 6-foot distance? I was under the impression that we were supposed to stay home aside from essential errands, and that socializing is limited to one's household members only. Good question.
Yeah, this is where it gets really challenging because even though we know a lot about the virus and even though we understand viral transmission pretty well from other experiences with other diseases, there's nothing magical about that 6-foot distance. The virus can get caught up in a breeze and it can float a little bit further than that. Depending on whether it's sunny, the virus may not survive even as long as that because of environmental conditions. So I think what we have are some general guidelines here for what we know is good practice to minimize the chances of transmission. And so, giving people a number that they can work with of 6 feet is helpful. It's not a magic number though. And so I think when we start to talk about socializing outside of the household, people getting together, as they're walking their dogs or jogging, naturally, we can sort of keep a distance, but then it's like when you're, accidentally getting a little bit closer, or somebody coughs or sneezes, or there's a little bit of a breeze, is there a chance that we might actually, be being exposed to the virus? It increases. So, I think what we have to be careful of is that these things are logical, they make sense, but when we start to push the envelope and saying, well, I was only 6 feet away, or I was only with them for a few minutes, or it was somebody that, it's a neighbor that I know and they look healthy, then we're sort of, every time we do that, we take a risk. And this is a time when we want to minimize that risk as much as possible. So we kind of have to ask ourselves, is it worth it? Yes, I would like to be visiting with my friends and neighbors, and yes, I would like to be able to go out and jog. But, every time we do that, we run the risk that something could happen. And just as an example, I think that it makes sense to be able to go outside and get exercise. It makes sense to, stay fit. And whether that's by cycling or running or taking the dog for a walk, or I like to surf, and so I like to get out there too, is there a chance that when we're doing those activities, we might encounter somebody in a way that we weren't expecting, whether it's, bumping into them at the, in a parking lot, and we end up getting too close because we're jogging, jostling around a car, or all these joggers all of a sudden coming up to a stoplight and they have to wait for the light to cross. And now you've got, a dozen people huffing and puffing right in the same area. We don't know if that increases the likelihood of the virus, spreading further than 6 feet. So I think we have to think about these things. And then, another situation is, if somebody gets hurt during one of those activities and they require assistance from strangers, whether it's an emergency medical professional or a bystander, now all of a sudden they're being put into risk, or you might be putting yourself at risk because you don't know if that other person is infected. And so I think we just have to kind of be rational about this. I know we can come up with lots of logical reasons why it's probably okay, but maybe it's better if we err on the side of caution and try to say, this is going to be difficult for a while, but it's a sacrifice that I think if we all are willing to make, we're all going to get through it sooner.
Thank you for that. I was texted by one of my staff members that as part of the stimulus bill, that there may have been some relief with regard to required minimum distributions for IRAs. So I will find out that answer, and we will post it, or we will get it out there. And I tell you, it was an 880-page bill. They gave us a day to read it. I skimmed all 880 pages as best I could, and it's quite a bill. I'll just say that. John in Carlsbad and Sharon and Dana Point, I guess, asked the same question. Has Trump signed and authorized the Defense Production Act? And if not, are there alternative tools that Congress can undertake in light of Trump's inaction? Well, the Defense Production Act is something that was a law long ago, several decades ago. So he didn't have to sign anything. He just had to invoke it. He had talked about invoking it, but hadn't actually done so until this couple days ago yesterday, when he compelled GM, General Motors, to produce ventilators. And I think, yes, I think he should use the Defense Production Act to whatever extent he can to try to fill the gaps in ventilators or PPE or anything else that's necessary to keep people alive during this public health crisis. So I'm happy he did that. It was overdue, just like his declaration of a national emergency was the right thing to have done, just overdue. So encouraging, but frustrating in the sense that it took too long. And I also worry that he put Peter Navarro in charge of the Defense Production Act, and I'm not a huge fan of Peter Navarro's, but it is what it is. Dr. Garfien, question from Lori in Orange County and I guess there's a similar one from Barbara in Oceanside. Is testing available in South Orange County? My friend in her 60s with underlying health issues flies all over the country for work. Well, that doesn't sound good. Presented with symptoms of COVID-19, tested negative for flu, but was refused testing in San Juan Capistrano. Barbara similarly asked, what should people do if they're exhibiting symptoms, but they have been refused a COVID-19 test because they haven't been in contact with anyone who is known to have tested positive? I have several friends who are in this situation.
Yeah, that's a challenging question. I think this is the situation where the tests are being reserved for those where the results are necessary for making informed medical decisions. In the case of somebody who has symptoms of COVID, test negative for the flu, it's possible to presume that they're infected with COVID and then treat accordingly. And the treatment there would be, if the person is not sick enough to be hospitalized, let them convalesce at home. You know, it's going to be, the symptoms are going to be like a flu. Might take a couple of weeks to recover, but the hope is that your immune system will ramp up and fight off the virus, and you'll recover and then be immune. If the symptoms get more severe, then obviously, as I mentioned earlier, it's important to notify your healthcare provider and to call 911 if the symptoms get severe. But the test itself isn't always necessary in order to provide the best medical care. I think it's reassuring, or it helps people to understand what's going on, to have the result of that test, but it's not the thing that the doctors always need in order to provide you with appropriate medical care. So I think as testing becomes more available, more people may get tested, just because we want to know the numbers of who was actually infected and who wasn't. But I think there's our doctors have gotten pretty good at being able to rule out, based on symptoms and other conditions, who isn't and is not infected, and so they can make decisions based on presumption.
Another one for you, Dr. Julian in Dana Point asks, the governor's order is being widely ignored in some of our beach cities. If the order is still ignored this weekend, can we expect local hospitals already short of resources to be swamped all at once in a week to 10 days' time?
That's a really great question, Julian. Theoretically, yes. If people are not following the orders and there's more mixing, then we would absolutely expect that the number of cases would rise, and that would ultimately end up with people in the hospital, and so that's a possibility. I'll say that I was on the cliffs this morning overlooking Del Mar, and I saw 2 lifeguard trucks patrolling the beach, there was only a handful of surfers in the water, but they were actually stopping and telling them to get out of the water and go home. And there were also no runners on the sand or on the railroad tracks up above. So I think people are doing a really good job of observing the stay-at-home rules. And I really appreciate that. I respect people for doing that. I know it's not easy. And I think that the other thing that we should also be thinking of is that I know it's easy to go stir crazy being stuck at home all the time, but maybe we can take this as an opportunity to sort of do the things that we always said, gosh, if I only had, a day when I didn't have to be at work, I didn't have other things to do, I would do whatever this is. So this is a good time to, find a good workout video. There's plenty of them online, practice some yoga, do more meditating. Or, take that guitar that's been sitting in the corner of your apartment and, learn how to play it. There's good YouTube videos to teach you how to do it. So rather than think of this as this time that we're all being imposed upon and we can't live our lives the way we want, try to look at this as an opportunity. What else could you do that you wouldn't have the ability to do if you were at work every day? So I guess I'm a glass half full guy, try to look on the bright side.
I organized the pantry, Doc, and that's something I've wanted to do
there you go.
Probably 5 years. So that's good. I was with some of my colleagues social distancing, so I wasn't that close to them, but we were asking each other, kind of what's going on in your community and what's unique about your community. And I said, man, the beaches are closed. And people looked at me like, what's the big deal if beaches are closed? I said, no, you don't understand. This is why we live here.
Yeah.
This is why we put up with everything else, so that we have this beautiful beach and beautiful ocean, and that we can go out when we want to go out. So this is really, this is a big deal. First time in my lifetime that that's ever happened. And I hope that, it's not the new normal.
Yeah, I agree. Well, my prediction is that when all this is over, we're going to have a flurry of garage sales, because all of us are cleaning out our garages. We got to do something with that, and I'm sure there's going to be a lot of people that could use a deal when this is over as well.
That's it. Yeah, that's a great prediction. Jack in Carlsbad asks, Philips in Carlsbad is manufacturing ventilators. Can we waive licensure so ventilators can be deployed to senior housing residents with rapid fire specific training, so that residents can be isolated in their residences without overloading hospitals? That's an excellent question. What I do know is that FDA has issued an emergency use authorization for ventilators. And there are other machines that might be able to be used, like anesthesiologists' machines might be able to be used for this. I think that we're trying to do anything and everything we can to try to produce more. Excuse me. Oh, got a cough in the arm. Okay. Sorry, Facebook.
I think you're home alone.
Cough into the arm. But I know that everything from Bloom Energy, which is a fuel cell company up in the Bay Area, they're making ventilators. And then GM and Ford are making ventilators as well. Yeah, I think anything and everything we can to accelerate the deployment of those ventilators will be critically important. Anything to add to that, Doc?
No, unfortunately, that's not an area of expertise for me, but I do know that when I hear my colleagues talking about repurposing equipment or getting equipment out as quickly as they can, these are definitely the kinds of things that they consider, and always looking for those opportunities. But I leave it to the experts to make the recommendations on how to do it safely.
Here's a question for you, Doc. Should we still be trying to test everybody? Assuming we get the tests that we need.
Yeah. Yes and no. Yes, it's good to know for the purposes of really understanding the magnitude of the outbreak, and for posterity purposes, the more we know about how widely the virus has been spread, we'll learn from that, and that will help us in the case of future pandemics where something similar comes around. The more we learn from this experience, the more better prepared we'll be for future circumstances. That was one of the things that we practiced a lot in the Epidemic Intelligence Service when I was at the CDC, is conducting these investigations, writing them up in great detail, publishing them, making it publicly available so that we learn from these experiences, and then we have something to go by when something new comes along. So I think testing will be very helpful in that regard. I think that testing also is valuable in helping to understand, who's at risk and who's not, so we can more rapidly move ahead in getting back to our day-to-day lives. But should everybody be tested? Well, I think at some point there will be less of a need. And because, as I said before, I think that doctors have now become very proficient in understanding, based on symptoms and other circumstances, who is likely to be infected and who's not, and can make appropriate medical decisions even without a test result. And so at some point, it might not be necessary to test every single person.
Thank you for that. And I was reminded by my staff that it is now after 5 o'clock. It's 5:06. We have a ton more questions. Doc, are you okay if we do a few more?
Sure.
And, we'll get to as many as we can, and we'll keep doing this, weekly. Next, will there be financial assistance for churches and synagogues from Barry and Encinitas? Barry, yes, and yes. As part of the CARES Act, nonprofits are included, and certainly houses of worship are included as well. And if you have any questions, or if your place of worship has any questions about those programs, don't hesitate to reach out to our office. Neil in San Clemente, will you introduce an infrastructure bill that will lead to long-term jobs and capital spending? These types of capital projects create long-term economic benefits for everyone. Neil, you and I are on the same page, my friend. I would love nothing more than to introduce a big, bold infrastructure package, and I wanted to do that before coronavirus, and I certainly think we should do it now, and we got to get people back to work, and this is a great way to do it. A comment for Richard. This is interesting. Let's use this is from Barry also in Encinitas. Let's use the vacant stadiums around the country as MASH units. They have access to water, electricity, sewage, etc. They are safe and protected environments. The military should have capacity, as all of our typical enemies around the world are dealing with similar issues. Keep a basic military capacity and our cybersecurity fully functioning, but otherwise let's use the full resources, human and otherwise, to address this issue. Any thoughts on using the stadiums?
I think it makes sense. You know, they used the stadium in Louisiana after Hurricane Katrina. You know, and I think that there are facilities that are available, and repurposing them makes sense. You know, Barry, I'm really glad that you suggested this. I think that it's by putting it out there so our listeners can hear you, maybe they have other suggestions. I think this is an area of expertise that I have, but I think that it makes sense. And I know that anything that we could do for improving surge capacity is great. I know UCSD and the county have been looking for places where they can shelter patients when the hospital beds get filled up. And you know, the more capacity we have, the better. So great idea. Thanks for suggesting that.
Stephen in Dana Point asks, doctors and nurses very much lack masks, hazmats, and ventilators. Trump has wasted last 2 months. Where are we now? Who is in charge to solve these shortages? This is the biggest bottleneck right now. If we have plenty of protection supplies plus social distance, we should be much better. Who's paying for those ventilators and protection gears? Well, what I can tell you is the CARES Act that we just passed and the president signed into law has $16 billion for the strategic national stockpile to buy everything from PPE to ventilators to all the rest of what we're going to need. The current amount of those supplies in the strategic national stockpile is too low. We weren't ready for this. And unfortunately, you know, we were caught off guard or caught flat-footed, the administration, and now we're trying to make up for lost time. So they need to take that money and buy those supplies and get those supplies as appropriate to states and localities. We also provided $1 billion, as I mentioned before, under the Defense Production Act specifically to buy supplies. And then we also in the bill had $4.3 billion to federal, state, and local public health agencies to purchase PPE and other equipment. So now I think that money is there. We're going to have to continue to follow up each and every week or every day to make sure the money is going to where it's supposed to go. But I'm absolutely mindful and of like mind with regard to all of that. James in San Clemente. San Clemente has an empty hospital ready to be used. What can be done to get this hospital reopened? They're working on that. We connected with the governor's office, and it's ultimately will be up to the governor to determine where to put more beds. Dr. Garfien, here's a question for you. I understand the U.S. has refused WHO test kits. Why? And are they still available?
Yeah, so that's a good question. It's partially true. What's true is that the U.S. Didn't use the COVID diagnostic test produced by the World Health Organization, and that they did that because they were developing their own. What's not true about that statement is that the U.S. actually didn't refuse the WHO test kits. They were never actually offered. And so, and this is not unusual because being the country that we are, we have the capacity to develop our own diagnostic tests. The World Health Organization didn't need to produce them for us or to offer them. We have more need right now, but it's they weren't refused, and whether or not they're still available, I don't know. I know that there's a lot of need around the world, and we can probably produce the tests for ourselves while making those tests available from the WHO for other countries that may not have the capacity to create them.
Thank you for that. We'll just do a few more. Lori asks, I'm reading that hospitals are running out of money as all scheduled surgeries are being canceled. Presume that elective surgeries, which I understand are pretty lucrative for hospitals. Hospitals are running out of money to pay their vendors and their payroll. How can we support our hospitals? So the stimulus package that we just passed, the CARES Act, includes $100 billion for hospitals. I don't know, and I actually think it's not enough. I think we probably are going to need more for our hospitals, but for now, that's in the bill, and I hope that money is the relief that a lot of our hospitals need. But this is something that's a moving target. We're going to keep our eye on this, and it's going to dramatically impact our overall strategy to make sure that hospitals are up and running and have enough beds to care for those who get this virus. Anything, Doctor, on hospital capacity that you'd like to add?
No, I think no.
Good. Here's one for you from Robert. Why isn't the government doing as much as possible to stop the pain, suffering, and death when drugs like Ativan, favipiravir, I think I got that right, are available in use in other countries? Sorry if I botched the name of that drug.
Yeah, I won't tell the Japanese company that made it that you did. This could be a very long answer, but I'll try to keep it short. What's happened is that throughout the epidemic in China, doctors have tried a number of different treatments to try to alleviate the pain and try to increase the rate of recovery of their patients. In doing so, oftentimes they tried drugs that have been approved for other purposes, and they thought they might work. So, trying drugs for an Ebola virus or an HIV virus or even the flu virus to see if it would work on these patients. And so the problem is that they were tried, but they weren't tried in the context of a randomized controlled trial. So if the patient got better, they don't know whether the patient would have gotten better anyway, or it was this drug that they tried. So now that data is coming out of China, and we're seeing that, and we're seeing reports that, these drugs like Ativan or chloroquine or some other drugs have been tried and the patients got better, it raises the possibility that they could be effective, but it's necessary to do the appropriate trials to see if they really work, because if they do, then we're going to be ramping those up in big time. We're going to be mass producing them, or we're going to be distributing them to hospitals and clinics and getting it out there. And if it turns out that it was a lark and they didn't really work, then we've wasted a lot of time and money. So I know it feels like it's slow, and we want to get treatments out there for patients as quickly as possible, but we want to get the right treatments out. So every one of these drugs, this anti-flu medication from Japan, the chloroquine and the hydrochloroquine, blanket on the other drug that was used for Ebola, they're all in trials now. They're being tried out, and they're being done in a rigorous way, quickly, but in a rigorous way, so that we can actually get the answers that we need, and then doctors will know if they really are working.
Thank you for that. Another one for you from Anne. Anne asks, 3 people in my family have important medical procedures scheduled this week. We're debating whether to go, and our doctors are not responding to questions about postponement. It appears taking the appointment is being left to personal choice. All 3 of us are in an at-risk category. Any general advice?
Yeah, and I really empathize, and I hope things work out for you. This is a difficult situation, and I understand how hard this is. I think the thing to do is talk to your doctors openly about your concerns. Ask them what precautions they're taking to protect themselves and their patients. Doctors, nurses, and healthcare staff are highly trained to minimize the risk of disease transmission. They're taught about personal protections and healthcare protections, and they should be implementing these procedures. So some things that you might want to know about are, how are they separating patients to minimize contact between patients and staff and other patients? So in other words, are they only having people come in 1 or 2 at a time as opposed to filling up a waiting room? Also, are they using the appropriate personal protective equipment to protect themselves as well as their patients and their staff? And are they also frequently disinfecting their facilities? So it's okay to ask these questions, and a doctor would probably be very happy to tell you what they're doing and to try to help you understand whether or not you would be at risk from the procedure that you need. You know, healthcare will go on despite the pandemic, and I think what we want to do is make sure that it's done in a safe way. But it's important for you to feel comfortable with that decision. So talk to your doctor, see, you know, be honest with them about your concerns, see what they have to say, and ultimately the decision comes down to you and whether or not you feel like the procedure that you need now is really worth the risk, or if it's something that maybe you can put off until, you know, things calm down a little bit.
That is an excellent way to wrap it up. And I want to thank you, Dr. Garfield, for once again just being so available to us, for sharing your wisdom. You know, I'm just so delighted that you've been able to do this. And you know, I wanted to also let you make any closing comments that you might have for this week.
You know, I'll just keep saying it again and again. You know, we're all in this together. I think that the social isolation is, it's an appropriate measure. I think if we can stick with it longer, give our healthcare system the opportunity to treat the patients that really need help and take the burden off of them, then we're all doing our part. And I appreciate what our, you know, political system is doing to try to help the country to survive this pandemic. You know, it's unprecedented, and it takes everybody pulling together. And I think that this is where government really has a role to play. You know, we all trust our government to do their part to take care of us, and we have to do our part to take care of each other. So
thank you. Thank you again for that. I want to thank everybody again for tuning in. It's a very difficult time for our country, and we know that the coming weeks are not going to be easy. I think that we're going to get through it as best we can together. Just stay strong and resilient out there. I particularly want to give a shout out to a number of my friends and colleagues that have been dealing with coronavirus. So specifically, our good friend Steve Padilla from the Chula Vista City Council and the California Coastal Commission, who's been hospitalized, who I believe is stabilized. Our friend Will Rodriguez Kennedy, the chairman of the San Diego Democratic Party, who was hospitalized recently and now is, to my understanding, is out of the hospital, which is fantastic news. And then, you know, a number of my colleagues who have tested positive, including a couple of good friends of mine, Ben McAdams and Joe Cunningham. Ben from Utah and Joe from South Carolina, two great fellow freshman members. So guys, you know, please get well soon. I know you're staying at home. And to another very dear friend of mine, Mark DeSaulnier, who's a congressman from the Bay Area, who did not get coronavirus, but nonetheless is critically ill up in the Bay Area. Mark, we're thinking of you and praying for your recovery as well. I also want to thank my great team, everybody that made this possible, our live streaming team, our great campaign team. As I mentioned, we've got all sorts of resources at mikelevin.org, which I hope everybody checks out. I hope this was informative. I hope you learned something. And I know there were just so many questions that were sent that we couldn't get to. That's why we're going to keep doing these. And we'll keep doing them for as long as this tragedy continues. And just stay safe out there, stay healthy, and thank you so much for tuning in. Take care, everybody.